The Laterjet procedure is a surgical technique used to treat shoulder instability, which occurs when the shoulder joint is too loose and prone to dislocation. It involves transferring a bone from the front to the back, where it is anchored in place to provide additional stability to the joint. That's right, it's cut off and moved over. We'll get into that. And recovering from a Laterjet procedure or any other type of surgery can be challenging and time-consuming. It typically involves a period of rest and physical therapy to help you regain strength, mobility, and function in that repaired area. In our video today, we're going to specifically be talking about the shoulder. Now, the length and intensity of your recovery will depend on the specific type of surgery you've had, your age, your overall health prior to the surgery, and how well you follow those post-care surgery instructions. During your recovery, it is important to follow your surgeon's recommendations and adhere to any activity or lifting restrictions. You may also need to use a sling or other supportive device to protect the shoulder as it heals. Now, pain management is also a crucial aspect of this recovery. Physical therapy will likely be a key component of the recovery process. Your physical therapist will work with you to develop a customized exercise program to help you regain strength, flexibility, range of motion in your shoulder. This will involve stretching, strengthening, and a series of small but super important movement, as well as balance and coordination drills. Now, before we go any further, it is super important that I lay this out. I am not a healthcare professional. I do not pretend to play one on the internet. We're only going to be covering my personal experience with a Laterjet procedure. And now that I am 3 months removed from that process, I feel like I can share with you some of the setbacks I've had, some of the small successes, and some of the things that, regardless of how much research I did, I couldn't really find any of these resources to adequately prepare myself, thus the purpose of this video here. So if you or someone you know is preparing for a similar procedure, then this one might be for you. Go ahead and share it. Give it a like if you found this useful. What it do? There is a previous video on this channel talking about the 10-day period and some of the things that I had learned and I experienced there, so I won't rehash a whole lot of that, but the short version is pain management is way more serious than I even thought, so definitely take that into consideration. But then, you get into 2 months out, and that's where some things started to come alive. Now, I did touch on some of the things early on that took me for a loop as far as what I first physically noticed, as far as, atrophy and loss of sensation and mobility, and I couldn't squeeze my hand, all sorts of little things like that. And some of those things did come online. I did find it useful to focus on the things that I could do instead of lamenting on the things that I couldn't do. So definitely take that. And at first, there were so many things that were just off. Happy to say more things are coming back online. It is still a very long road ahead. When I started physical therapy, I thought this would have been just like any other injury that I've had from my years of strength training, running, cycling, and, other physical activities that, I'd get in and after about 2-3 sessions start to feel better and then everything else was just supportive. Not the case. I was really hoping that I'd be able to drive my car and get myself around to a couple of places. And that took, about 3 weeks of physical therapy before that could happen. The first day of physical therapy was so arduous. And even trying to do some of those things at home led to an awful lot of involuntary spasms. And I just wasn't ready for that. If you've ever had that kind of situation, then you already know that it's pretty frightening. And I was at home and had no idea what was going on. I thought I had heard something. Turns out, with the reconstruction and, tendons being moved and your whole anatomy is rearranged. And some of these things are waking up in their new homes and freaking out just as much as I was. Once that starts to settle down and things are, becoming more commonplace as far as oh, right, this is how we're going to move now. This is what the range of motion is going to be like. The next thing that I quickly noticed was how much my left side had atrophied. And I'm talking about the bicep, which that tendon got rearranged. Then I'm noticing, hey, there's this divot here. Oh, right, this is where the bone was transferred from the front side down into the back side of the socket. It's been cold here in the Boston area, and I'm feeling the titanium screws that are in my shoulder now. And that's a new sensation. And the biggest shock beyond all that was, why are things on the right side of my body starting to hurt? You probably already guessed it. Well, you're overcompensating, right, for all the weakness that you have on the left side, not just in the shoulder, but in your scapula, in your lats, all throughout your posterior chain, my core. Well, the right side is compensating for that and has been working overtime in the last month for sure, as we've been ramping up physical therapy. So now that all is tight and hurting, and wow. All that to say, it is a full body recovery. Going in, I thought that, all right, it's just my shoulder, but my legs still work. So I started getting on the treadmill for as long as I could tolerate. I started getting on the indoor bike for as long as I could tolerate. And I say as long as I can tolerate, we're talking, 10 minutes at first was the max. And then, I ramped up to where I am today. I can maybe do about 30 minutes on the bike before I just can't hold this position anymore. So many of the strength training things are out. So you might be wondering, well, you need to strengthen your core, hit some planks. Well, can't really do a full plank position. I've got to do kind of a modified plank. I've got to do modified everything really, just to protect the repaired area, but at the same time, trying to minimize the strain that I'm putting on my unaffected area. So it's this gentle balance, and finding that, okay, well, maybe it's a good thing that I can only tolerate about 30 minutes right now, because anything more, oh, that's more compensation that the right side is doing to make up for the instability over here. Other things, you look at some of these, small movements that we're doing in physical therapy, and you couldn't have told me, compared to, 4-hour training sessions and long hill climbs and marathons and ultra endurance events, that 30, 45 minutes of physical therapy of just like, external rotations and squeezing a foam ball and using, little bands would have been so exhausting. And it really, really is exhausting. I thought this was going to be stuff that I could just knock out and get along with my day. But boy, after one of these 30-minute sessions of doing little and assisted movements, I am beat. Along with that, you want to talk about a surprise. The snap, crackle, and pop of the scar tissue starting to, move and be flushed away. Not only is it an audible shock, it is also a pop I can feel, and then a warm kind of burning sensation. The upside though, because there's always some good news, thankfully, is that after some of these pops, I can't plan in which direction and in which way, but I've been finding that my range of motion increases, centimeters at a time, but I can now reach to the back of my head, which I couldn't do a week ago, right? And, thinking about 2 months ago, I couldn't do that. I couldn't reach my ear to shave my head, but your boy's clean today. So there is progress happening. It is very slow. When they first told me my surgery was in October and I wouldn't be able to swim again until, June, I thought, yeah, okay, sure thing, buddy. I'll be back in February. No. My immediate thought was that they were erring on the side of caution, but, I got this and it's going to be no sweat. No. Turns out they're the professionals. They've seen some of this before, and it is going to be a slow process. Thankfully, I'm young, in pretty good shape going in, and also pretty disciplined about following instructions, and executing a training plan. So I'm looking at this recovery as my new training plan. And as my physical therapist is outlining what I should be doing and what I shouldn't be doing, I am following those cues and very, very carefully listening to my body and reporting all those things back. That dialogue between you and your medical team has to be super sharp. This is not the kind of thing where no, I'm just going to put it off. Definitely take some notes, and don't be shy about relaying those notes and what's going on. I can't even tell you how many times I've had to ask a question about something I'm feeling, and they had to remind me that, dude, your anatomy has been rearranged. That's why you've got this divot missing, because the bone that used to be there is gone. Oh yeah, that's why you've got this snapping in your hand, because that tendon is still tight. This is why when you lift your arm, you're getting this pull in your rib cage, because it's all attached together and your lats are there. This is why you're getting this pain in your shoulder blade, because you can't do something to the front side without affecting the back side. All that to reiterate that you absolutely need to be communicating, especially with something this invasive, really any kind of surgery. You gotta stay on top of it, and 100% I recommend advocating for yourself. So that's where I'm at 3 months from surgery, and your results may vary. Different folks may take a little longer, different folks may be up and running, and others may choose to completely bow out and say, you know what, this is good enough, but it's not good enough for me. Now, recovering from a Laterjet procedure, or any other type of surgery for that matter, requires patience and a commitment to following your post-surgery care instructions. It's important to rest and protect that area as it heals, and to work with your surgeon, your physical therapist, to develop a tailored recovery plan specifically for you. Not one of these cookie cutter, talk about what your goals are and really advocate about what you're looking to get out of this. Be patient. With dedication and hard work, you can make a full recovery and get back to enjoying your favorite activities. And if you have any questions about your recovery, don't hesitate to reach out to your healthcare professionals. Literally what they're there for. So where does that leave us? As I said in the previous ones, it looks like there will not be any races on the calendar this year. Maybe a half marathon, but that's still an outside shot, as I'm finding out that, even my hamstrings, my calves, all of these things on my right side are overworked. So there's no need to rush into it. If this means taking a year off of racing so I can get 20 years back, I'll take it. But that's me. If you've got any questions, don't hesitate to leave them in the comments. If you're going through something similar, if you know somebody who is planning or preparing for this kind of procedure, or if they've recovered from a different procedure, let me know. Let's have a conversation. If you found this useful, don't be shy about hitting the like button. Check out some of the other videos where I talked about exactly what happened, what led up to it, and the decision to have this specific procedure. Not common. It's actually really funny when I tell folks that, they assume it's a rotator cuff, which is very, very common. This is not so common. Anyway, we're gonna sign out. It's been real.